Hi, my name is Heidi Schutz, and I will be presenting the clinical case for LC for APN 505. To give a brief patient overview, Elsie is a 32-year-old female who is an English archaeologist slash treasure hunter. She is a vegan, denies tobacco use or alcohol use, and is single. The HPI consists of the patient reporting a 3-month history of abdominal distension, 16-pound weight loss, nausea, worsening epigastric pain, poor appetite, and new onset vomiting. She was evaluated on a remote village clinic, which at that point she was prescribed antacids with no relief. 5 days after the initial treatment, she complained of headaches, cough, diarrhea, fever, night sweats, rash on the bilateral extremities, and general feeling of unwellness. At that point, she was flown to Texas for further evaluation and management. Here she developed hypotension and pulmonary edema and was admitted to the ICU, where she was put on mechanical ventilation and put on TPN. Imaging revealed positive for roundworms, or the Ascaris genre. Surgical resection was performed. The full duodenum was removed in addition to the proximal jejunum. Enteral feeding was initiated on day 4 post-operatively, and a bowel transplant is scheduled in 1 month with the Cleveland Clinic Foundation. Her primary diagnosis was the hantavirus pulmonary syndrome, valley fever, small bowel obstruction, secondary to Ascaris. Secondary diagnosis consists of profound protein-calorie malnutrition and disseminated intravascular coagulation. Some basic anthropometrics. She is 175 centimeters. Admission weight was 53.6 kilograms. Her BMI is 17.4, and her usual body weight is 61 kilograms. Her pertinent past medical history includes that she is type 1 diabetic. She's had acute pancreatitis secondary to trauma, vitamin B12 deficient, Crohn's disease is diagnosed in her early 20s, and hyperthyroidism. Pertinent surgical history includes a history of terminal ileal resection secondary to Crohn's, and her family history is unknown as both of her parents are deceased. Clinical labs are noted here. The only relevant ones that are not within normal range are the ones you'll see here. So everything you see listed, her BUN, creatinine clearance, potassium, both the liver enzymes ALP, AST, albumin, white blood cells, hemoglobin, and her vitamin D are all outside of normal ranges. Current medications that Elsie is on is Vyvanse, levothyroxine, vitamin B12, Cimzia, a multi-mineral supplement, and vitamin T supplement as well. All of the associated reasons as to why she's taking these medications and duration are listed next to them. Upon her hospitalization, Elsie is prescribed a couple other additional medications that are listed here: the antiparasitic ivermectin, omeprazole, loperamide, cholecystramine, magnesium oxide, famotidine, and 50,000 international units of vitamin D12. Patient, just to give you a brief overview of the nutritional clinical course, the patient is put on enteral feedings, specifically Jevity for the type of nutrients listed here, 1620 kcals, 68 grams of protein, and 816 cc's of free fluid. She's recommended for 34 cc's of water for 24 hours, and an increase in protein intake due to the stage 3 pressure ulcer on her coccyx. Overall, patient summary includes 32-year-old female with 3-month history of abdominal distension, poor appetite, 16-pound weight loss, nausea, epigastric pain, and vomiting, admitted with a new 5-day onset of hypotension and pulmonary edema. After mechanical ventilation, patient is put on TPN. Imaging revealed a small bowel obstruction secondary to Ascaris. The entire duodenum and 22 centimeters of the proximal portion of the jejunum is resected. Day 4 post-operatively, patient recovers with full bowel function, and Jevity is initiated at 1.5 calories, 45 cc's per hour for 24 hours. Protein intake is also being increased due to her stage 3 pressure ulcer on the coccyx, and a patient is scheduled for a 1-month follow-up for a complete bowel transplant at the Cleveland Clinic. Primary diagnosis is the hantavirus pulmonary syndrome, valley fever, small bowel obstruction, secondary to the Ascaris, and secondary diagnosis of profound protein calorie malnutrition. Significant past medical history includes type 1 diabetes, Crohn's, acute pancreatitis, hyperthyroidism, vitamin D deficiency, pelvic fracture, and terminal ileal resection. Family history is unknown. We are going to focus here on the primary diagnosis of the hantavirus pulmonary syndrome. And moving on, 2 PES statements were created in regards to this patient. Number 1, altered GI function related to decreased functional intestinal length, as evidenced by a recent small intestine resection. Number 2, protein calorie malnutrition related to acute disease and coccyx stage 3 pressure ulcer, as evidenced by a decreased albumin and increased creatinine levels. The nutritional implications for LC are as follows. Having had 2 resections of the small intestine, specifically the ileum and the duodenum, some complications can arise and some things that we need to be cognizant of. Malabsorption of bile salts, reduced electrolyte and fluid reabsorption, as well as certain type of vitamins such as calcium, magnesium, and zinc are to be something to consider. Other micronutrient deficiencies as well. Protein malnutrition is a concern. She was below her BMI on admit. Post-enteral feedings and surgery are also something that will put her in an increased risk. So looking at the certain markers for protein status, such as prealbumin and albumin, will help. Vitamin D deficiency, will further monitor and evaluate that. And other deficiencies in vitamins A, D, and potassium, as well as understanding her fluid volume status. And we can monitor that by looking at her electrolytes, glucose, her bun and creatinine. Certain ones were without normal limits or outside of those normal limits, as evidenced in that previous slide, specifically the bun and creatinine. So a couple ways that the body is impacted throughout her LC's entire hospitalization. So starting with the circulatory system, again, rounding everything back to the primary diagnosis, which is what basically is a viral infection is what's going on between the pulmonary syndrome and valley fever. So in a viral infection, your immune system starts to mount a response, specifically lymphocytes recruited, such as the T cells. Eosinophils are recruited. Their job is specific to parasites, as you can see here in the graph on the right. T cells are specific to viruses. So those are 2 types of cells that will begin a response. She does develop hypotension and pulmonary edema while being hospitalized. So her decrease in her serum albumin and a rise in the hematocrit will basically show how that possible pulmonary edema is developing with that fluid shifting to the lungs, and low blood pressure, systemic low blood pressure ensuing as well due to this viral infection. So again, kind of rounding everything out, focusing on these 2 diagnoses here of the 2 viral infections. Moving on to the lymphatic integument and the integumentary system. Basically, again, we're trying to fight off some foreign invaders. So we have an innate and an adaptive immune response that begins. Elsie was presenting with some fever, with some cough. She had that rash on her bilateral extremities, indicating the inflammatory process beginning within her skin. Again, those white blood cells are going to respond that we spoke about earlier. And a rise in temperature. Our skin is one of our main physical barriers of defense. So, we're going to try to make uncomfortable environment for that foreign invader. So that's why our temperature in our body rises, to try to create that hostile environment for that virus. Digestive system. So in addition to that primary diagnosis, she also had that small bowel obstruction secondary to the roundworm infection. So there's a blockage there going on in her small intestine. That's going to create some problems as we have kind of a holdup there in the entire, digestive process. So it's going to interfere with nutrient absorption. It's going to slow down digestion. She presented with nausea, abdominal distension, pain and bloating, all stemming from this obstruction there. The resection that she she had in both the duodenum and the ileum, as you can see in both of these pictures. The one, the arrow that just pointed to, that is the duodenum, and the other one here on the right is going to be the ileum. And because those two areas have been impacted and resected or removed, vitamins A, D, E, and K are going to be impacted, as that's what the duodenum primarily absorbs. And the ileum, the vitamin B12, is going to also be impacted. So this is just kind of a little brief rundown as how that roundworm affects bodily systems. You can see at the bottom there that it's usually contracted from rodents, their fecal matter, and on the ground. So once that's contracted, it's inhaled, and you can see how that kind of makes the life cycle goes all the way up, and that larvae are eventually swallowed and entering the GI tract and kind of festering there throughout the small intestine. So the effects of protein malnutrition, which is part of that secondary diagnosis, can affect somebody in multiple ways. So as we can see here in this diagram, there is reduced body weight, there is muscle wasting, decreased strength, respiratory and cardiac muscular capacity. That thins, the skin starts to thin out. There's decreased metabolic problems going on. Edema in the extremities can start to develop. Immunodeficiency can also start to develop. So as you can see, protein malnutrition can have a very severe impact on the integumentary system, the respiratory system, musculoskeletal system, and circulatory system. Here's the reference for my previous slides, and I thank you so much for listening to me today.